Blepharoplasty or tear trough depression. Hi folks, I always had a problem with under eye bags and finally considering getting it fixed. I think it was partly been caused by allergies. When I was younger, my eyes would get big and puffy and sore consistently. I considered blepharoplasty, but then I'm fairly nervous about that and just found out about tear trough depression. I would prefer the non-invasive route, but which do you recommend and will it have a big effect? Thanks so much for your advice.
Thank you for your question. So it's clear that you are aware that you do have puffy bags under your eyes and that you were naturally concerned about having blepharoplasty. And now you've learned about the world of tear trough and whether or not it would be beneficial to you. Well, I'll share with you some straightforward anatomy and as well as what the realities of correcting the tear trough is. First of all, to define the tear trough, this area is an area of relative depression adjacent to the puffy eye bags. So a few years ago, hyaluronic acid became the treatment of choice, and hyaluronic acid such as Restylane, Juvederm, these are basically gels that are made of hyaluronic acid, were used to place underneath, and quickly this became the non-surgical eye lift, and people were running around, especially non-surgical physicians, celebrating that they found the holy grail of dealing with eye bags. Well, the reality, unfortunately, is that anatomy is anatomy, and the fat that prolapses forward is such that beyond a certain level, the hyaluronic acid does not really help improve the appearance of the bags. I know this firsthand because in our practice we see patients pretty much every week who have gone to a non-surgical doctor who injected all this filler underneath and made them look like they have even bigger bags. And that's the unfortunate additive effect. You see, fillers help to fill out depressions, but when there's this mountain, this adjacent area of fat prolapse, then you have to use a whole lot of filler to try to make that look like one straightforward layer. And just do this for yourself. Take a side view picture and notice the roundness and the bulge of that fat, and realize that the contour of an eyelid that does not have a fatty bulge is relatively straight or even concave. So by adding volume at that level, I think you would probably not get the benefit that you're looking for. For people like yourself who are concerned about the risks of eyelid surgery, I've been able to, over the 20 years of my practice, help people get past that by dealing with some of the most significant objections. One is, of course, anesthesia. So we do our procedures under local anesthesia. And as far as for men in particular, most of my procedures, we don't make any incision on the outside. A lot of men have been very concerned about the potential for a scar that would be obvious. You know, women can typically wear a little makeup if they wanted to blend a scar in, but for men that's usually not an option. So we do, for most of our male patients, we do a procedure called transconjunctival blepharoplasty. Transconjunctival blepharoplasty means reducing the fat pockets from the inside of the eyelid. This way there's no external scar. We also do other procedures to help improve skin quality and skin texture and even color, such as the use of platelet-rich plasma and the use of fractional CO2 laser or radiofrequency technologies such as Pelave. But there is essentially, we have to address the puffy bags first. Doing it under local anesthesia with light sedation also reduces the downtime. We are able to get most of our patients looking pretty good by about 1 week. So once a lot of people who are hesitant about surgery learned this, they realized that if they went for an injectable or a filler, they'd still have to deal with the potential for bruising and swelling. So it's kind of like the same social risk, if you will, as having surgery. So by doing surgery, we kind of have a definitive procedure to address the fatty pockets. Now, does that mean that you won't need anything for your tear trough? Well, that's subjective. If you feel after the puffiness is reduced that the tear trough area is still deep and that's normal, once you get beyond the age of 30, 35, there is a volumetric loss in the face where you lose bone, muscle, and fat, and the area between the eyelid and the cheek is an area that tends to hollow. Adding volume can be a strategy. I can share with you that for most of my male patients, that option is not usually exercised. Most male patients feel that, like bodybuilders, a certain level of leanness is normal and is fine. So it is okay. But for a lot of our female patients, they want a little bit more fullness in the cheeks. So I think that practically speaking, you should find a doctor to help you with your lower lid puffiness rather than chasing the expensive and I think not likely to be fruitful route of a non-surgical tear trough filler. So I hope that was helpful and I wish you the best of luck. Thank you for your question.